Good morning, student. Now I am going to tell about administration of nasogastric tube feeding. How to give the feed to the patient through the nasogastric tube. Nasogastric tube, other name is Rayleigh tube. Naso means nose, gastric means stomach. Through the nose to stomach, we are inserting the tube. So directly food material entering to the stomach. So through this process, we are giving the feed to the patient. Here also we are seeing the definition, purpose, indication, article, finally procedure. Now start with the definition. Administration of the feed directly into the stomach through a tube. So here main concept is we are giving the feed directly into the stomach with the help of the tube. The tube is two types are there, that is the nasogastric tube. One is the orogastric tube. Naso means nose, gastric means stomach. Through nose to stomach, we are inserting the tube. Second one is orogastric. Oro means mouth, gastric means stomach. Through mouth to stomach, we are inserting tube. So this is the two ways are there how to give the feed. Next, we will see the purpose. So purpose, totally three purposes are there. To provide adequate nourishment to the patient who can't feed themselves. The patient is who can't take feed their own. Like that patient, we are putting the nasogastric tube, then we are providing the feed. Second, to administer medication. If we want to give any medicine, the patient can't able to take through the mouth. That time, through nasogastric tube, we are providing medication. Third one is to provide nourishment to the patient who can't be feed through mouth. For example, surgery in the oral cavity, unconscious patient, coma patient. If any surgery happened in the oral cavity, in the mouth, any surgery happened, our patient is unconscious, our patient is coma stage. Like that means we can't give the feed properly to the patient. That time we are inserting the Rayleigh tube and we are providing the feeding. Indication. Next we are seeing the indication. What are the indications are there? Indication means which patient we have to do this procedure. Head and neck injury. The patient has had a head and a neck injury. Maybe road traffic accident. Maybe the patient is fall down. Like that any injury happen in the head and neck, we can provide the nasogastric feeding. Then coma patient, obstruction of the esophagus and oropharynx. In this place, any obstruction happen, we can provide nasogastric tube feeding. Recurrent episode of aspiration. That means if patient is taking any food means immediately it will get aspirated. Then patient will get breathing difficulty. The patient is going for the unconscious stage. Like that patient, we can provide the nasogastric tube feeding. Then increased metabolic needs. Burns patient, cancer patient. If patient is having burns, the patient is having cancer, like that patient we can provide. Then poor oral intake. That means some patient will take very little amount of the food. So like that patient, we can insert the nasogastric tube and we have to give the feeding. This is the indication. Next, we are going to see the articles. What are the articles is needed? Feed. According to the doctor order, we have to prepare the feed. Then container, maybe some vessels or some glasses like that we have to take. Then large syringe, we have to take large syringe. Minimum we can take the 50 ml syringe. Water in a container. Why water is needed means after giving the feed, we have to insert the water also. Then stethoscope. Stethoscope why needed here means we have to check the Rayleigh tube where it is present. If it is in correct position or wrong position, we have to check. For that, we need stethoscope. Kidney tray, towel, clean gloves, Macintosh. Then we will move on the procedure. So what is the procedure? Identify the patient and explain the procedure to the patient. If patient is conscious means we have to explain the procedure to the patient. Why we have to explain means we have to reduce the patient anxiety. We have to make them ensure the patient cooperation. And second one is assess for food allergy, time of last feed, bowel movement and laboratory values that we have to check. Assess for the food allergy. If any vegetables they are taking means if they are getting any food allergy, we have to see. Then what time patient is taken the last food, that also we have to see. bowel movement present or not. Why we have to see peristalsis movement is present or not. Then digestion process we have to observe. For that we have to check the bowel movement. Then place container with the feed in the warm water. We can't give the cool food. We have to make a normal temperature food only we have to provide to the patient. Then we have to make a patient in comfortable position. That is the Fowler position, 35 to 45 degree we have to maintain. Then why we are making this position means to prevent the aspiration, to prevent the risk of aspiration. After making the comfortable position, we have to do hand washing and we have to wear the gloves. Spread the towel and Macintosh over the patient chest. After that, what we have to do means we have to take a towel and Macintosh. We have to put the patient chest side. Why we are putting means if anything soiling in anything when we are feeding, it will fall down means it's getting disturbance to the patient. At the same time, the bed sheet, the patient gown, everything will get soiled. So that we have to use towel and Macintosh. We have to cover over the patient chest. After that, what we have to do means attach the syringe to the nasogastric tube. After that, we have to take a 50 ml syringe. We have to attach to the nasogastric tube. Aspirating stomach content. Why we are doing aspirate means? And aspirate means we are taking some food item fluid from the stomach. We have to do aspirate. If there is doubt about the tube placement, inform physician and obtain an order for X-ray. If you are withdrawing, if you are aspirating, the stomach content is not coming. That means some misplacement happened in the Ryle's tube. Immediately we have to inform the doctor and we have to do X-ray immediately. Why we are doing X-ray means in X-ray only we can identify where the NG tube is present. In the Ryle's tube, we have the one small line, the straight lines are present, that is a radio opaque line. When we are taking the X-ray, we can see the radio opaque line. So where it is present, the NG tube also we can identify easily. If it is going without any problem, that is the NG tube placement in correct place. If tube placed is confirmed in the stomach, pinch the feeding tube and attach the syringe of feeding to the tube. So once the placement we confirmed in the stomach, what we have to do means we have to pinch and attach the syringe. After attaching, what we have to do means we have to take a fluid and we have to take above the head level. Why we have to take above the head level means that is the gravity. Easily it will go inside the patient's stomach without any disturbance. So pour feed into the syringe, allow it go flow by gravity. Don't pour too much fast, don't pour too much slow. Slowly we have to send the feed inside the tube and we have to make that level above the patient head only. Then after feeding is completed, flush the tube with at least 20 ml of plain water. Why we have to do means prevent clotting of the feeding tube. So we have to, after the feeding, we have to put some water inside the tube. Like the same method, we have to take 20 to 30 ml plain water we have to take and we have to pour it. Why means to prevent the clotting of the feeding tube. After tube is cleared, close the feeding end of the feeding tube to prevent leakage. Why we are closing means to prevent the leakage. Rinse equipment with the warm water and dry. After the feeding is completed, what we have to do means this equipment we have to clean with the warm water and we have to dry. Why we are doing means to prevent the bacterial growth. Keep head of the bed elevated for 30 to 60 minutes after feeding. We have to make the patient bed elevated 30 to 60 minutes we have to maintain. Why means to prevent aspiration. We have to make the proper position after the feeding. Then wash hand, remove the gloves, document type and amount of feeding, amount of water given and tolerance of the feed. After this procedure, what we have to do means documentation part, what type of feed you given, how much amount you given, how much water you given, that everything you have to maintain in the documentation. Monitor for the breath sound, bowel sound, gastric distension, diarrhea, constipation, and intake output. That everything we have to maintain in the documentation part. Instruct the patient to notify nurse if he experience sensation of fullness, nausea, or vomiting. If patient feel anything discomfort, we have to explain them, inform immediately to the nursing staff. So this is the nasogastric tube feeding. So this picture is continuous feeding. So we connected with one feedback. The feedback is connected to the nasogastric tube. So automatically the feeding is going into the patient's stomach. That is the continuous nasogastric feeding. So first we have seen definition, then purpose, indication, article, procedure. This is all about the how to feed nasogastric feeding to the patient. Thank you.